The July death of Northern Arizona University football player Malik Noshi was caused by an opioid overdose that led to the renewed awareness of the impact of the opioid epidemic in Arizona.
Flagstaff has become a hot spot in the state's opioid crisis. Reporter Yannone went to this city in northern Arizona to find out how treatment centers are handling the problem. Jena?
That's right. Arizona has had more than 3,600 suspected opioid deaths since the summer of 2017. In Coconino County, there's been an alarming rise in opioid-related hospital visits, which is why we wanted to know how the community is rallying together to fight this issue. Flagstaff is taking action against opioids. The community is weaving together two programs, one focusing on crisis response and the other on preventing overdoses and making treatment centers available. The goal is to put a stop to this problem that's taken and damaged so many lives.
I will say Flagstaff, it's a very generous town. There's a lot of amazing organizations and people who don't just talk about helping, but are committed to giving that hand to people and just helping them to have a better life.
According to local health officials, opioid-related hospital visits in Coconino County increased 285% from 2011 to 2016. To try and prevent additional deaths, the government distributes naloxone to locals, a common way to treat narcotic overdoses.
The opioid crisis response program really works to sort of connect the dots for people who have experienced an opioid overdose or who are deemed to be at risk of an overdose.
Survivors are connected with a community health worker and a peer support specialist. The county and state government also offer an overdose prevention program. Locals say their strong sense of community is key to having a successful recovery. Alex Cutler previously struggled with substance abuse, but now works at a treatment center. He thinks that Flagstaff offers a unique approach to recovery.
The community that's built around this place, I feel like the word community is like becoming kind of like a cliche, like everybody needs community, but like it's so true. Like as human beings, I feel like we really need that. And as a human being in recovery, like absolutely, I needed support. I needed people to get over that hump of how to stay sober and, live happily. So
Back to Basics uses activities-based recovery strategies such as cooking and outdoor expeditions. The program's therapist says that treating the mental and emotional side of addiction requires patience.
The single greatest predictor of long-term success to maintain sobriety, no matter what the substance is length of time in treatment. They need to catch up. They started using when they were maybe early teens, and they've missed some developmental, emotional sort of ability to cope with things. And that is length of time for them to catch up that way and learn who they are.
Jennifer Leland now works helping others get out of the cycle of addiction she knows well. The patient, she says, must be ready to commit to helping themselves.
They have to want it. They have to be willing. I've been in recovery myself for 7 years. I was into methamphetamines for about 25 years. I was an addict, and I got clean.
The Arizona Department of Health continues to track the number of suspected overdoses and deaths. As of last week, nearly 60,000 doses of naloxone have been distributed statewide. In the broadcast center, I'm Jenna Yannone for Cronkite News.